So from that video, we've learnt where these ligaments are, and now we're going to talk about what the actual functions of the ligaments are. So the annular ligament, which is wrapping around the head of the radius, that's the one that really just locks in and allows, wraps around the head of the radius to allow the pronation and supination to take place. So that pivot joint at the proximal radial ulnar joint is made possible through this annular ligament. Now the two collateral ligaments, the ulnar collateral ligament and the radial collateral ligament, both play roles in stabilising the joint from lateral based movements, and they both become active during lateral, whether it's medial or lateral rotation or movement laterally from the elbow. We're often asked to talk about the stability of the joint, and the same three characteristics are always coming in at the top of the list. The first is the bony articulations, so the way the two bones come into contact with each other. And the rule really is that if a bone's sort of wrapping around another bone in any way, it's generally first or top of the list. So here we've got the ulnar, which wraps around the end of the humerus there, creating a nice sort of deep groove for that hinge joint at the elbow. That is the number one thing affecting the stability of this joint. Ligaments and muscle tendons, or muscle and muscle tendons, obviously used sort of interchangeably in this topic because they both contribute to the factors of stability. You're not often asked which one is more, but sometimes it's obvious and sometimes it's less obvious. So in this case, we've got the ligaments of the elbow contribute to the stability, sort of second most important, and then the muscle and muscle tendons, sort of which are wrapping around and over this joint, affecting that stability or contributing to the stability next in line.